In this lecture, we'll be discussing effectiveness and accountability. In today's practice landscape, mental health professionals are being held increasingly accountable for the effectiveness of the interventions they use with clients. Now, there was a time when clinicians could justify their use of interventions purely by saying they chose this intervention based on their experience or their clinical expertise, but this is no longer the case. So personal and professional experience will no longer suffice as the primary standard for justifying treatment decisions. We as practitioners need to demonstrate increased accountability for our work with clients. We have to demonstrate not only that what we do is safe, but that it makes a difference. It's helping clients meet their goals. Insurers will allocate funds based on the review of client outcomes. So you may be working with the client, and the third party, the insurance company that is paying for their services, may ask for a review of your records. And if your client is not making progress toward their goals, the insurer may choose to stop reimbursing you, stop paying you for your services. And also, sometimes insurers will only reimburse or pay for services that are empirically validated or supported by research. So if you're using a method that's not supported by research and thought to be effective, then they will not pay for those services. And we also must deliver services that are consistent with current and established guidelines. So you have to use services that are supported by the current literature, the current guidelines for dealing with those particular issues. So we refer to this as evidence-based practice, practice that is supported by the empirical evidence or by the research. So APA defines evidence-based practice as the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. So you're integrating, number one, the research, but also the clinician's clinical expertise. So the clinician is not totally left out of the equation. So you're combining the research, your expertise in the area, along with client characteristics. So their culture, their preferences, you integrate those three things to arrive at evidence-based practice. So this involves translating research findings into everyday clinical practice and using it to substantiate treatment decisions. Now, the good thing about evidence-based practice is it weeds out ineffective and potentially harmful treatments. Now, this is not to be confused with treatments that have not been thoroughly researched yet. There are some treatments that have not had their efficacy proven by research. This is different than what we call debunked types of treatments, things that have been found not to be effective. So we've weeded out things like boot camps for teens with behavior problems, things like scared straight programs where you take teens into a prison system and the thought is that the prisoners will scare them out of their delinquent behavior. This has proved to be more harmful than beneficial. Things like the DARE program, which was a drug prevention program, turned out not to be effective. So these things have been debunked. We know these treatments are not effective and they're no longer used, or they should not be used anymore. So how do you become familiar with EBT? How do you know which treatments have been found to be effective by research? First, you can look at lists, registries, and reviews available from your professional organization. So the American Psychological Association, the National Association of School Psychology, they will have lists of interventions that have been supported by research. When you're looking for these interventions, make sure that you're paying attention to the benefits and the criticisms. So you wouldn't want to select an intervention purely because the research says it's effective. Do the benefits of that align with your client goals? Are these benefits that you're seeking for your client? So just because it's effective doesn't mean that it's a good fit for your client. And also look at the criticisms. Some of the criticisms may contradict the fact that it's effective in general, and these criticisms may let you know that this particular intervention is not likely to be effective for your particular client. You also want to take note of how each intervention attends to cultural factors. So how does it integrate cultural factors in the delivery of the intervention? An ideal intervention should be well defined, so it should be clear how it should be used. It should reflect the client goals, so it should help the client progress toward the goals you've developed in therapy. It should also be consistent with societal goals. So it should have some societal benefit. It should, of course, demonstrate effectiveness. It should have minimal side effects. It should have positive long-term outcomes. So does it just have, benefits in the short term, or does it have benefits that last for years into the future? It should have a reasonable cost. It should be relatively easy to implement, and it should be adaptive to diverse communities and client subgroups. So, what are some of the concerns and critiques of evidence based treatments or evidence based practice? Some clinicians feel like it's a one size fits all approach. They feel that it's so manualized, so prescribed for the therapist that you're just, applying the same intervention in a cookie cutter manner to all your clients. So it's a one size fits all approach. Many of these evidence-based practices are identified for a particular diagnosis. So you can look through some of these lists or manuals and it'll say this particular intervention is effective for clients with major depressive disorder or bipolar 2 disorder or, schizophrenia. But what about clients who have comorbidity, meaning they have more than one disorder? So these types of practices don't usually speak to that situation. So what if you have a client who is depressed but also has a substance abuse disorder? Is this intervention that was found to be effective for people who are depressed also effective for people who have a comorbid substance abuse issue? And what about clients who do not meet diagnostic criteria? So what if your client has some features of depression, some depressive symptoms, but they don't meet all the diagnostic criteria? Is this same intervention going to be equally effective for somebody who has some symptoms of depression but does not meet all the criteria to be diagnosed with major depressive disorder? So this is a gray area that some of these evidence-based treatments don't address. Some mental health professionals feel like evidence-based treatments create an over-reliance on manuals. So a lot of times you'll have these treatment guides and treatment manuals that tell you exactly, every step of the way to using this intervention with clients. So some clinicians feel that their autonomy, flexibility, and creativity is being restricted by these manuals. And they feel that adhering to a treatment manual may compromise their clinical expertise and judgment. So sometimes the manual may say, do one thing at this particular point in therapy, but the therapist, based on their own experience and expertise and judgment, may feel that this is not the right step to take with this client at this particular time. And the manual may restrict that use of your own judgment. So what some people advocate for instead of evidence-based practice is practice-based evidence. This is collecting evidence from routine clinical practice and using that to determine the effectiveness of an intervention. So you, in working with a client, use an intervention and assess and see if that intervention is effective. If that intervention is effective, then you continue to use it with the client. So as opposed to looking to research and seeing what the research says is an effective intervention, you use the data collected from your own practice and your own work with clients to determine what is effective for working with them. So how do you integrate evidence-based practice and multiculturalism? Now, traditional psychotherapy and traditional evidence-based practices have been primarily developed and validated on European Americans. And there is some evidence that these interventions are not equally effective with people from different ethnic or racial groups. So existing EBPs must be adapted to fit the needs of culturally diverse clients. So here's some things to consider when using an EBT with a client who is not of the majority race or ethnicity. You have to consider things like interdependent value systems, for example, the family system. So we know in Western society, we tend to be more independent. So you may typically guide your client to make decisions that are in their own best interest. So you may have a student in a college counseling center who is trying to decide, well, do I pursue the career that my family wants me to pursue, that they expect me to pursue based on the fact that they came to this country and they sacrificed in order to give me a better life? Or do I pursue the career that is my passion, that may be lower paying or is not in keeping with my family's values? Well, from a Western perspective, we may counsel that person, this is your life, you have to do what's best for you. You have to, choose a career that makes you feel most fulfilled. that might not be realistic or keeping with their cultural values. So you may have to discuss about the role that the family will play in determining that client or that student's career path. So you have to consider those different types of family systems and dynamics that may vary by culture. You also need to consider the influence of spirituality in the healing process. I've referred to this several times in different classes, and you'll probably hear me bring it up again. I was at one time working with a client who was an amputee who was Hindu, and she was really focused on determining what she may have done in the past life or what she did to make her deserve to have this accident and deserve this injury. That is not in keeping with my understanding of her injury. From my perspective, things just happen, things are our control. Some things happen for not a particular reason, but you can make meaning out of that situation. But for her, she was very invested in understanding what could I have done that made this happen to me. So I had to integrate her spirituality into the healing process. You also want to consider the influence of poverty. You have to take into consideration your client's particular financial situation. So you may want them to attend um, AA meetings or different meetings, but they may not have childcare. They might not have transportation. There may be other things that prevent them from accessing some of these resources that you would like them to use. So you need to take those things into consideration. So here are some common types of cultural adaptations to evidence-based practices, and this list is by no means exhaustive. So you might want to do things like incorporating cultural values or concepts into the intervention, providing services in the client's native language, collaborating or consulting with individuals who are familiar with the client's culture. You may want to provide extra services to increase client retention, like we talked about, childcare, transportation. Those things may help clients from different cultures or different, financial backgrounds be able to use your services. Something you always want to look at is when choosing where your practice will be. Is it close to bus stops? Can people who don't have their own cars easily access your building? You might want to consider doing things like orally administering written materials for illiterate clients. And something else I want to mention about this. Sometimes people will be literate, but they may not have an understanding of all the jargon included in something like your informed consent document or something in the assessment. So rather than giving people written materials and assuming that they understand it, even if they're able to read it, you might want to discuss those things with them to make sure they understand it. And you can also engage in outreach efforts to recruit underserved clients. So how do race and ethnicity impact therapy outcomes? So the research indicates that groups of same race clients who receive services tailored specifically to their cultural group improved considerably more than clients who were in mixed race groups. So being in groups of people of the same race, using intervention that's tailored to your group tends to be more effective than being in a mixed race group where the intervention is not tailored to a particular culture. Clients matched with therapists of their own race or ethnicity fared no better than clients who worked with a therapist of a different race or ethnicity. So lots of times people will assume that a client works better with somebody from their own racial or ethnic group, and the research doesn't support that belief. Clients did fare better when paired with a therapist who spoke their native language. So whereas race and ethnicity didn't tend to make a difference as far as client outcomes, having therapy being conducted in their native language did improve their client outcomes.